Hello everybody. First of all, I would like to thank Professor Gao Xianfu very much for his kind invitation to present our treatment methods in a keynote lecture at the conference with the topic Scoliosis Prevention and Control. Scoliosis is a three-dimensional deformity of the spine and trunk. It differs from a pure postural deformity with free mobility in that it cannot be completely corrected. This is due to the fact that the cause of the deformity lies in a growth disorder, which also leads to changes in the shape of vertebra and intervertebral discs. Scoliosis may have many causes, for instance, neuromuscular, myopathic causes, but also connective tissue diseases, congenital malformations, as well as other extremely rare determinants. (80 to 90%, which means vast majority of all cases, affect otherwise perfectly healthy individuals, and these scolioses are called idiopathic scoliosis, which means scoliosis of unknown cause. Nowadays, however, there is strong evidence that idiopathic scoliosis is based on the functional tethering of the spinal cord, which is manifested by an impediment to movement, by a localized impingement of the spinal cord in the spinal canal. Scoliosis treatment consists of three basic pillars. First, pattern-specific exercises and physical rehabilitation. Second, corrective braces. And third, surgery. Now let's have a short glance on pattern-specific exercises. Prospective controlled studies and also randomized trials support physiotherapy and more intensive scoliosis rehabilitation. However, only pattern-specific corrective exercises such as Schroth and Schroth best practice have been scientifically validated at such a higher level. Non-specific exercises such as SEAS, Dobermed and others have not been sufficiently scientifically evaluated. Besides reducing the incidence of progression, the Schroth program improves pulmonary function, reduces pain, improves health-related quality of life, reduces right cardiac strain, improves muscle endurance, and improves coordination and postural control. Of the pattern-specific scoliosis exercises, the Schroth Best Practice program is now the most widely used method worldwide. It is the latest development which aims at automating corrective activities of daily living. In order to achieve the necessary postural control, highly corrective exercises are required, which makes asymmetric tension pattern of the back muscles tangible and easily reproducible. On this slide one can see the 50 times exercise. More core stabilization exercises, like the so-called muscle cylinder, are also part of our program. A recent development of scoliosis rehabilitation is the 5-day best practice rehabilitation program, which should have been implemented in Wuhan in 2020, and we all know what came in our way. Now let's have a look at brace treatment. Brace treatment is also supported by some prospective cohort studies, as well as by a randomized controlled trial by Weinstein and co-workers. This study has become known as the Bracing for Adolescent Idiopathic Scoliosis trial, or BRACED for short. Unfortunately, brace application is hardly standardized, and thus widely varying success rates can be found in the literature. While highly corrective Chenot braces perform significantly better than Boston braces, there are also studies with Chenot-style braces, obviously with insufficient quality and with a very low success rate. The Gensingen brace is prone to quality management and is characterized by a success rate of about 90%. If one applies the success criteria of the brace study, the curvature does not reach or exceed 50 degrees, then the Gensingen brace has a success rate of 96% compared to the 72% from the brace study. According to the latest evidence, neither soft braces nor the nighttime braces can be recommended for patients at serious risk of progression. Now I would like to focus on scoliosis surgery. On this picture one can see a Harrington rod fusion with a well-aligned trunk. While there is a large body of scientific research on scoliosis surgery, all systematic reviews of the last 2 decades prove that there is no medically justifiable indication for surgery. The most recent review was published last fall and is shown on this slide. The reviews on the complications of scoliosis surgery also demonstrate a high rate of long-term complications. In one study, within 5 to 20 years postoperatively, the implant was removed due to complications in 48% of patients treated with the CD instrumentation. Martha Halls found in her systematic review clear evidence that many of the possible long-term complications are often not even associated with a long past surgery. Later, our working group found similar results as published 2008, as can be seen on the right. Currently, there is no medical justification for scoliosis surgery in the literature, especially since there is evidence of clinical as well as radiological loss of correction in the medium term. Thus, only conservative scoliosis treatment has been sufficiently proven scientifically, and patient safety is highest when using the Schroth best practice program and the Genzingen brace. This means that the success rate for the patient is the highest with the Genzingen brace, and significant cosmetic improvements are also possible. The Genzingen brace is also the smallest possible high correction brace. Here we have some cases showing possible outcomes of pattern-specific high correction braces. A boy with collapsing spine before brace treatment with a nice recompensation at brace weaning. Here we can see a Chinese girl from New Zealand treated in my office in Genzingen with a nice recompensation as well. A patient from Turkey successfully treated in the office of Nikos Tournevitis in Greece with a Genzingen brace. And finally, a patient from Norway with a collapsing spine nicely recompensated as early as after 6 weeks, as can be seen on the upper left. This patient won a model contest in California 2 years after brace weaning. The question now is, what other therapeutic measures can be recommended? Manual therapy, osteopathy, and chiropractic are primarily methods for treating painful dysfunctions. Manual therapy and chiropractics are used to treat pain, especially when the dysfunctions or blockages prevent the corrective exercises or brace application. There is, however, no scientific evidence that the above methods could stop curvature progression of a scoliosis in the growing age. The realization that idiopathic scoliosis is based on a functional tethering of the spinal cord with an obstruction of spinal cord mobility in the spinal canal has led us to the systematic application of shockwave treatment. This method leads to a reduction of pain, to a relaxation of back muscles, and to an improvement of the finger floor distance as an expression of a better spinal cord mobility. Since the latter effect has been found to be short-lived, we have developed a special exercise program to promote spinal cord mobility, largely derived from an advanced Qigong protocol. This treatment module today is part of the Schroth Best Practice program. Some of these so-called detethering exercises can also be performed at the workplace. Here we can see one sequence of an advanced detethering exercise. The use of acupuncture and Chinese herbal medicine is rarely mentioned in the literature on scoliosis treatment. I myself have conducted a controlled pilot study in which it was clearly demonstrated that proper acupuncture compared to sham acupuncture resulted in significant improvement of postural asymmetry as measured by the phometric surface topography system. We were guided in the selection of points by the Chinese diagnosis of false heat, often found in young scoliosis patients with kidney yin and qi deficiency, often with a tendency to liver blood stagnation, which is probably due to the described imbalance in the water element. Of course, the already described successful therapy modules, such as the Schroth Best Practice Program and all the Genzinger Praise, should not be replaced by these methods. However, it could be investigated in a controlled study whether at all or to what extent traditional Chinese medicine as an add-on would prove to be beneficial and helpful. I would like to conclude my lecture with the results of a patient from China treated by my friend Na Xianfeng with a thoracolumbar curve exceeding 40 degrees. The treatment consisted of brace treatment using a Genzinger short brace and of the application of the Schroth Best Practice physiotherapy program. A nice in-brace correction has been achieved. And the final result is quite remarkable, with a nice recompensation of the pelvis and with a vast reduction of the thoracolumbar hump. Thank you for watching my video lecture. I wish you a pleasant conference ahead.